3IE, by way of background, supports and undertakes the production and dissemination of reliable evidence to help decision makers in Africa, Asia, and Latin America make well-informed choices. We work with governments, foundations, NGOs, development institutions, and research organizations, and offer expertise across an extensive range of evaluation services. As background for today's seminar, we are now, the world, in what has been designated as the Decade of Nutrition, supporting Sustainable Development Goal number 2, which is about getting to zero hunger. And as many here know, current trends suggest that we, the world, are not on track to meet that goal, despite many efforts to improve nutrition internationally, many good efforts. Policymakers and implementers need to be equipped with the best available evidence. 3IE and many of the organizations represented here in the panelists are working hard to help with that. Before we start, a few quick housekeeping notes. When sending questions to the panel, please use the Q&A question and answer box for questions, not the chat function. And please name the panelist you would like a response from if you have a specific person in mind. If the event is disrupted for any reason, we will shut it down and reach out to you over email. If my internet fails and everyone else's is going fine, Charlotte will take over as chair. The event is being live streamed on YouTube and shared on social media. If you are joining our event via live stream, please leave your questions in the comments box. Also, we encourage you to tweet any questions or points of view. Please tag @3IE News on Twitter and use the hashtag evidence dialogues with an exclamation point at the end. So now let's get started, taking care of the preliminaries. For today's discussion, a panel of leading experts on food systems and nutrition will share with us their perspectives and conclusions on the work being highlighted here. And our panelists have they are very distinguished, have many qualifications, so my very brief introduction won't do justice, but it's all in the spirit of saving time for us to get to the real issues. So Lujain Al-Qudmani is the Director of Global Action and Project Portfolio at the EAT Forum. Purnima Menon is Senior Research Fellow at IFPRI. Kristen MacNaughtan is co-lead for Nutritious Food Systems at the Bill and Melinda Gates Foundation. And Stan Zlotkin is Chief Center for Global Child Health and Professor of Pediatrics at the University of Toronto. So thank you all for taking time out of your busy days to share your ideas here. In addition, Marc Nolting, who is head of the unit on Global Agenda for Food and Nutrition Security at GIZ, the organization that funded the evidence gap map that will be talked about in this session. He has kindly sent us a recorded message since he could not join today in person, unfortunately. We'll begin with that recording, which will give us an overview of the approach that GIZ and BMZ, the German government's development agencies, of their approach on the importance of evidence, why they commissioned the work, and how it has been used. So with that, I'll ask my colleagues to play that recorded message.
Good afternoon, ladies and gentlemen. Unfortunately, I cannot attend in person today, but I'm happy to send you this short video message for this important webinar on behalf of GIZ, the German Governmental Organization for International Development Cooperation. First of all, a big thanks to the International Initiative for Impact Evaluation for hosting and organizing this important event today. Why is evidence on food systems and nutrition relevant for German development cooperation? Well, during these times of multiple crises with increasing rates of hunger and malnutrition, it is of greater importance to use the available resources effectively. Therefore, we need evidence-based approaches to improve the effectiveness of our programs and policies. At GIZ and for our main commissioning party, the German Federal Ministry for Economic Cooperation and Development, BMZ, evidence does play a very important role. In this regard, strategic collaborations already exist, including a partnership with the European Commission, but also with national stakeholders in partner countries and with research institutions. For example, this includes our program Knowledge for Nutrition, in short K4N, which is co-funded by the European Commission. K4N advises BMZ and the European Commission to increasingly base nutrition-relevant policies and programs on evidence-based approaches and strategies. Other than that, we do collect data, for example, in a multi-sectoral nutrition program, in which through standardized impact assessments, we gather data at subnational level in 10 countries and that are used to inform national partners on the nutrition situation in country and to enhance nutrition governance at a global scale. Now, the commissioning of the Living Evidence Gap Map on food systems and nutrition has been an essential step to systematically map which evidence on food systems is there. Based on this evidence gap map, we went on one step further and commissioned the Rapid Evidence Assessment on Women's Empowerment Interventions in Food Systems, as well as the Systematic Review on Fiscal Policies to Support Healthy Diets. And we are happy that these results are presented today in this seminar. Especially the topics of women's empowerment and gender transformative approaches are prominently featured in our work and in the work of this study. Gender transformative approaches are of great importance in the work of GIZ, especially in the unit Global Agenda for Food and Nutrition Security that I'm currently leading. With the results of the Rapid Evidence Assessment, we are right on time to better integrate gender transformative approaches as one characteristic of a feminist development policy that is one key issue of our work. Now, what are my expectations in terms of using the evidence gap map and the results presented today? For the future, I'm confident that the Living Evidence Gap Map will be very useful for other relevant stakeholders. For us in GIZ, it has been already one important step to fund this interactive tool and to have the relevant evidence at hand for better policy advice to BMZ and for the design of our future programs. So far, we have been using the evidence gap map in the development of research priorities that we commissioned within GIZ, but also to fine-tune project activities based on the latest evidence. We are also aware of partners who are using the tool for similar activities, and we do hope that the living character of the evidence gap map will be continued together with other partners to ensure that we have an up-to-date evidence base that we can refer to and increasingly base our policies and programs on the latest robust evidence. Ladies and gentlemen, I'm certain that today's webinar will contribute to further dissemination of the immense potential of this interactive tool. The deducted evidence synthesis is a concrete example how to generate concrete recommendations from it for policy advice. Having said that, I wish you a very fruitful discussion today, and I'm looking forward to our future exchange. Thank you very much.
Great. So that sets the scene and gives us the perspective that we can now build upon. I'd like now to turn to my 3IE colleague, Charlotte Lane, to give us a bit more background before we then launch into the exchange from the panelists. Charlotte?
All right. Thanks, David and Marc, for those introductory remarks. It's always interesting for me to hear how other people are using our work. So I particularly appreciated what we just heard from GIZ. As David and Marc noted, we're in some really challenging times at the moment, especially when approached from the field of food systems and nutrition. The global outlook is pretty bleak. But I don't like approaching it that way so much. For the last 2 years or so, we've been working alongside our partners at GIZ and other organizations such as Amana to map the evidence about what we can actually do to transform the food system and support a healthy diet for the global community. We're now trying to take that work one step further and synthesize it to come up with some good actionable conclusions, as Marc mentioned in his introductory remarks. So this work started with something that was a pretty big undertaking in and of itself. Alongside an advisory group, we developed a comprehensive list of all of the interventions that are being considered within the food system to improve food security and nutrition in low and middle income countries, and all of the outcomes that those interventions are trying to address. We ended up with 58 interventions and 57 outcomes, which is a lot. From there, we identified all the impact evaluations and systematic reviews of impact evaluations, considering these interventions and outcomes in LMIC context. The goal of this mapping exercise was twofold. So first of all, we just wanted to figure out what information was out there and where the gaps are. Given the size of the literature base, that is a pretty big and important goal in and of itself, because it can help us prioritize research production in key areas where there are gaps. The second goal of this was to make the information readily available to people by organizing it in a simple online matrix format that was easy to navigate through an online platform where people could go to studies that directly considered their interventions and outcomes and filter to specific contexts that they might be interested in. So in our original EGM, we ended up with over 2,000 studies, and I was just excited by that. I think that that's an incredible amount of information that we have. And the assumption is that somewhere buried in all of that information, there has to be some good information on what works, for whom, and at what cost in order to support evidence-informed decision-making. So that's how I was approaching this the last time I presented the food systems and nutrition evidence gap map about a year and a half ago. I was really optimistic about the possibility of us as a global community leveraging this information to help make use of the evidence, make evidence-informed decisions, and start implementing policies and interventions that mean meaningful improvements to our global food security and nutrition landscape. However, as everyone knows, the world has changed a lot in that year and a half. Our global situation is now seriously different. And while the changes that upended everyone's lives have been hugely important, they have not fundamentally changed the evidence landscape or the importance of responding to those three important questions: what works, for whom, and at what cost. So 3IE has been working to keep our original food systems and nutrition evidence gap map up to date. Since publishing that original map, we have added over 200 studies to it, meaning that 10% of all of the studies in the map have been added in the update period. The global community is generating a massive amount of evidence in food systems and nutrition, and that makes sense. In order to develop a safe, sustainable, and equitable food future, we need to transform the food system. So while the map is a great tool to help donors identify what areas to fund and policymakers or implementers to investigate specifics about their interventions or outcomes, the map does have an important limitation, which is that it doesn't answer questions like, does this work? What are some key contextual factors affecting the impacts of an intervention? Or should we do this intervention at all? Those questions require evidence synthesis, and they're also the types of questions that policymakers and stakeholders tend to be asking when trying to make decisions. So those are important questions that 3IE set out to answer as a next step based off of the map. We're now leveraging the food systems and nutrition evidence gap map to conduct systematic reviews and rapid evidence assessments on key areas of interest for the global community. We started this project out just looking at two hot topic areas of interest within the food system, looking at women's empowerment and fiscal policies. As everyone knows, there's been a recent international push to support women's empowerment across all sectors. Women within the food system have a particularly interesting role because they're often assigned to positions as mothers and cooks, which makes them targets of a lot of interventions on consumer behavior. And these actually can perpetuate cultural stereotypes. So interventions are encouraging women to be responsible purchasers and preparers of food without approaching them as food producers, processors, or vendors. Within the food systems research, we're seeing women relegated to this secondary role in quite a lot of areas. So at 3IE and alongside GIZ, what we wanted to know was what are the impacts of women's empowerment interventions within the food system to support nutrition, health, and well-being. The results of our research were really interesting. So first off, there were only 10 studies within our EGM that looked at the impacts of women's empowerment interventions within the food system. These interventions focused on women in the agricultural sector, and they provided women with education or asset transfers. These interventions that were trying to empower women were not approaching them as consumers, but were thinking about women as food producers. And they tended to work. They improved food security, affordability, and availability. However, an important caveat here is that cost evidence was pretty limited. All that we can say is that there's suggestive evidence that combining behavior change communication messages around women's empowerment with these education and asset transfer-based approaches may have some impact in lowering the costs relative to if they were implemented separately. So switching gears to that other synthesis product I mentioned, we looked at the effect of fiscal policies to support a healthy diet. There's been a big global push by international organizations and national governments to take these fiscal policies as systemic ways to improve food access, diet, and health. A lot of what people are doing these days is adopting taxes and subsidies to change the relative prices of foods and thereby encourage a healthier diet. However, there just isn't that much evidence on whether or not these approaches work. There's some work on purchasing behavior and a fair bit of qualitative information on perceptions of and reactions to these initiatives. We found that taxes on sugar-sweetened beverages do seem to reduce the purchase of these products, but that result was driven by a single study that had a high risk of bias. The research of on the impacts of these initiatives on the outcomes that they're actually trying to affect, like diet, health, and well-being, is really limited. There was only 1 or 2 studies looking at these outcomes within each category, so we weren't able to make any broad conclusions. That said, in the last update to the EGM, we added our first ever study that looked at the effects of SSB taxes on BMI. So this really highlights the importance of keeping the map up to date, because we found that study pretty much as soon as it was published, which is really exciting. Unfortunately, the study found that there was no effect of the sugar sweetened beverage tax on BMI. So despite being widely implemented now, there's just insufficient evidence to know if taxes or subsidies affect diet and health outcomes. There's an important caveat to this finding, though, which is that taxes can be impactful in another sense. They likely increase revenue, and that revenue can be used for other health and well-being programming. So if that's the goal of the taxes, they can still be thought of as an effective intervention. Okay, I'm going to hand it back to David and the panelists in a minute, but before I do that, I just want to frame the discussion a little bit. At 3IE, like David said, we try to support the adoption of evidence-informed policy. And we do this by generating actionable and easy to use evidence. Within the food system, we have a lot of evidence, over 2,200 impact evaluations at this point, but that doesn't mean that it's actionable and easy to use. So what we're asking the panelists to reflect on is how the tools that I just discussed in particular, and then evidence in general, can be used by donors, policymakers, implementers, and other stakeholders to make evidence-informed decisions and support food systems transformation. So David, I think I hand it back to you to talk to the panelists.
Great, thanks, thanks, Charlotte. And just before we dive into going around the panel, and Kristen, will start with you. Just before that, for anyone, listeners who want more information on the evidence gap map, there is a link in the chat box. And at the very outset, I thank the panelists. I also want to thank the listeners. And we now have a very large number. And thank you, because you have busy days and lots going on. And we look forward to ideas that you can share with us through your questions or subsequently. And appreciate very much your participation. We are conscious of your time, so we've got ourselves a schedule which calls for the first round of comments by each of the panelists to stick to 5 minutes or less. And if I start to go ballistic, if you're going over your time, please don't take it personally. It's just the way we have to run things to make sure we get everyone's good ideas on the table. So with that, Kristen, coming to you, what are your thoughts on how this work that Charlotte and before her Marc were discussing, how it can and should be used, and whether there are important points we should keep in mind about making sure it is not misused. So Kristen, over to you.
Thanks, David, and thanks, Charlotte. Certainly, Charlotte, what you were saying, what Marc was saying resonated with me, and how we're already thinking about, the value of this gap map. And it's an honor to be here to discuss how we can improve the strategic collection, interpretation, and use of data and evidence. The fact that BMZ commissioned this important work and committed to making it a living gap map is so valuable. As you discussed, tremendous effort goes into developing robust synthesis products and making them useful for interpretation. And in this case, over 2,000 studies, in addition to the work on the usability with the smart visualizations, and knowing that it'll be routinely updated will make it an important resource for food system stakeholders over time, and something that we'll come back to again and again. It's notable that already within the last update, what the new contributions are, what evidence has been filled in, and where we still have gaps. So I'll reflect briefly on how the evidence in gap map and other products can be used and potentially misused, where they bring value and where we might have reasons to be cautious. Our team at the Gates Foundation, the Nutritious Food Systems team, focuses in on improving the equitable consumption of safe, healthy diets year-round. While others on the ag team focus on production and income, we're really focused on people as consumers. And as such, we're interested in that through line of how the agri-food system can provide healthy, safe options to the markets where vulnerable consumers shop and the drivers of demand for healthy diets. We're always trying to keep tabs on who's funding what and where, how we can make strategic decisions about the use of our resources to advance the field and fill knowledge gaps, and how we can promote the uptake and use of data and evidence for policies and programs. It can be really hard to track the scope of research, especially when we're talking about the breadth of the food system, which spans production through to consumption and crosses several sectors and disciplines. I mean, it's even harder to remember when results will be in and when papers will be published. The evidence synthesis and gap maps are so important. They're important markers of the state of the evidence, and they really help researchers, funders, and decision makers digest this massive amount of information quickly. We certainly look to them in advance of issuing funding calls and in developing or shifting our strategy. And it's, as I said, it's an incredible resource to have a living gap map. And what I also love about 3IA's work here is that it includes research underway, so we can know what's coming down the pike. Given that it can take several years from study origination to the results and publication, it's really helpful to know what evidence has been commissioned and when we'll have those results. And also, comment that the reports themselves and the takeaways are incredibly useful tools and guidance documents and an important accompaniment to the gap map. There are a few challenges, however, especially when it comes to the interpretation and the use of the data for decision making. Charlotte touched on what the map can do and what it can't do. And it's important to convey that on repeat for people looking at the map. The farther you go from people who technically know the material and the discipline and about research methods, the easier it is for gap maps to be misread, misinterpreted, and misapplied. The map itself is from, where I said it's first and foremost a tool for researchers, the way it's structured and the filters, et cetera. There's a certain barrier to use and application for policymakers and decision makers who, for example, might know they want to solve a problem linked to the food environment, but they wonder about the approach or the tools or what can be translated from another country or municipality's experience. That high level of disaggregation can be overwhelming. And when combined with perhaps a lack of understanding on study design or what to do if there's some evidence, but the quality is subpar, just knowing what to do is challenging. So before this is actionable, as Marc alluded to, as Charlotte talked about, there's a need for researchers or someone else, the way that GIZ, helps BMZ interpret this, or the way that, there's embedded folks within governments to help interpret data, how they walk alongside and help draw out those meaningful elements and interpret what is known and what can be immediately applied versus, where we have a bit more guesswork. That's an important component in looking at the gap maps. Another way funders and decision makers need to take care is around how we consider replicating or scaling something that's been effective in a singular context, perhaps a tightly controlled environment with more funding and support than might be normal. Often, that how of program implementation has a key role in success with ties to context and enabling environments, and that doesn't always come through in papers. So it's important to consider what can be picked up and replicated and what needs to be rethought or tested for new contexts. It's common to talk about that pilot to scale and think that's a linear line, but we all know there's so many ways things break down, and we need to unpack those assumptions we're making around how programs can be translated. And then just one more point I'll say is that another area where help is needed is that prioritization of research. Again, going back to the high levels of disaggregation and gap map, it seems like we could fund research endlessly if you just look at that and feel like you're trying to, fill the holes. So with limited resources, there can be a perceived tension between research and implementation and an impatience for research's sake, rather than focused work that's responsive to policymakers. And Charlotte mentioned this too, that important and critical role of that prioritization piece. The reports that 3IE has do a really nice job pulling up from the map and honing in on some of those areas. But a common challenge with great visuals is that people don't always take a look at that report and they don't always read how you intend. So we really do need that help in that translation piece before the gap map itself is actionable. It's wonderful to hear that the the rapid evidence assessments are underway, and those will be really valuable accompaniments to this tool. I'll stop there. Hopefully I'm within my 5 minutes and turn it back to you, David.
Absolutely. Thanks, Kristen. Lots of great thoughts there that I hope we'll come back to. I won't take up time reiterating them just now. We'll go on next to Purnima. Before you begin, Purnima, I just want to point out to my colleagues that some messages are coming into the Q&A saying that the chat box is disabled, and so I guess that means they can't read anything that's coming up in the chat box, but I leave that to the technical experts to work on. And Purnima, coming now to you, you have over a decade of experience in implementation research on scaling up maternal and child nutrition interventions, including evaluating large-scale behavior change, communication programs in nutrition and health. Based on all of that experience in several countries around the world, what do you see as the next step in this work? How do researchers get policymakers to act on evidence and get donors to invest in under-researched areas? And if people are not likely to change their opinions based on a brief, what do we need to do? So this is kind of the natural next set of questions after Kristen sort of outlined really nicely what we can use, but also the cautions and some of the challenges of using this kind of information. Tell us where your thoughts are.
Thank you so much, David, and thank you 3IE for this wonderful opportunity to be with you today. It's really, for me, just fantastic because, as some of you know, we are launching a whole series of new research programs in the CGIAR. And having this incredible evidence gap map is so helpful in steering direction and helping us see everything that's out there. So first, I just want to say I think the EGM and then the living EGM idea are both really just fantastic for those of us who are researchers and want to sort of keep up with the latest. And like Kristen said, I also really value the fact that it includes, research that is underway and not yet reported out and published. I think, again, for researchers, that's really great. Now, in thinking about, my remarks in relation to this, and I think what I really wanted to focus on was, what happens next when you have an evidence gap map or you have a synthesis of evidence from the gap map. The idea that we want research or evidence to shape decisions and actions, my experience with that, both in the BCC work that we've done in many other countries, but also drawing on the work that we've been doing in India under the Poshan initiative to, sort of engage policymakers and really a broad policy community, not just a set of policymakers on using evidence, is that it's really forced me to think about who are the people in this wide network of what we call the policy community, and what are the kinds of decisions and actions that they're taking or that we want them to take that should then be informed by evidence. And, so in this case, with the evidence gap map, I sort of see two sets of potential policy actors or two sets of actors in any policy or evidence community, and different decisions that each of those actors would need to take or that we would want them to take that are based on the evidence. So the first is, a set of actors who should use the evidence that exists. And there, I think we think about people who are, setting agendas, shaping discourses, thinking about their policies or about the programs that they're funding and saying, well, what is the evidence saying that is in this evidence gap map that I should then use to think about what some of those things look like. And that requires that next step that Charlotte spoke about, not just seeing the evidence that's there or not there on the gap map, but actually digging into what is that evidence saying and what is that evidence saying in my context. I have encountered so many people in the policy community in the last 10 years who are just really dissatisfied with the idea that you would have evidence from a very different context and want them to use that to shape a policy in their context. People want evidence. Smart policymakers want evidence from their context to shape the decisions that they will make for that context, right? So I think for me, we need to look at the evidence gap map, look at the evidence that's in it, place it in context. If there isn't enough evidence, say in India or Bangladesh or a South Asian country or even for the region, it's going to be very difficult for us to tell the policy community in that context that there is enough evidence for them to act. Which leads me then to the second set of actors, or the second set of actions that come out from an evidence gap map, which is to fill the gaps in the evidence. And there too, I think you're looking at a range of different actors. You're not just looking at big global funders, but you're also looking at domestic national resources for research. How do you create space? How do the people who are research funders in national context, for example, in India, there is a Principal Scientific Advisor's Office, there is a Department of Science and Technology, there is the Indian Council of Agricultural Research and the Indian Council for Medical Research. These are all entities that hold actual financial resources and the ability to shape research funding within their context. And I think, for me, I would love for us to think about what happens next with an EGM with both of these, not just how is evidence used for policy and programs, but how are evidence gaps used to shape the future of research in itself. And it requires dialogues. It requires a dialogue between people who are evidence users in a certain context and people who have the ability to shape a research and a research funding agenda, perhaps in the same context. And so for me, what we really need to talk about then are the people. Who are the people who can be knowledge brokers, who can help foster this conversation in context, both to guide evidence users, so they can use and ask for evidence to be synthesized from within this amazing repository in the EGM, as well as people who are going to be the ones to help fill evidence gaps. And I think we are missing a trick if we don't talk about the importance of embedded knowledge brokers in that context. So let me leave you with that. And I hope that we can circle back to this idea of people in the knowledge ecosystem who can play this kind of a role of, helping both knowledge users and knowledge creators and funders. I'll stop there. Thank you.
Great. Thanks, Purnima. Lots for us to dig into more. But first, let's go to Lujane, to your thoughts. What do you think about the existing evidence that is available for decision makers and policymakers?
Thanks, David, and good day from Oslo. It's a pleasure to be with you here today, and thanks to 3i Impact Organization for their kind invitation to join this important discussion. Building on what the previous panelists have already shared, the last couple of years have been quite rich, actually, by the growing number of research, reports, and evidence around the status of our current food systems. What should healthy, sustainable, and equitable food system look like, and how to get there? And I would like just to mention a few examples of that evidence. First, the Eat Lancet Commission reports on food, planet, health that was published in 2019. And this commission has set for the first time ever the science-based targets for food systems to just simply answer one simple question, which is how to feed around 9 billion people by 2050 a healthy diet without destroying the planet. And the commission introduced what we call a combined approach as an answer to that question, which is first transition to planetary health diet, which is a diet that is plant-rich, flexitarian, and can be locally adapted to different contexts. Second, adoption of sustainable production practices to stay within the planetary boundaries that the Commission has defined as the upper limit of environmental effects for food production at the global scale. And third, to have food loss and waste in line with the SDG targets 12.3. And another good example is the Global Panel on Agriculture and Food Systems for Nutrition, GLOPAN report, that has been set up to support governments in low and middle income countries to develop evidence-based policies and key steps that make high quality diets safe, affordable, accessible, and available. And their future food systems for people, our planet, and prosperity report made that case for urgent and fundamental transformation of food systems to improve diets, ensure sustainability, and build resilience. Zooming a bit into aquatic systems, we have also the Blue Food Assessment that brought together over 100 world-leading scientists to study blue foods, has just published a series of reports that highlighted the diversity of aquatic food as a source of protein and other nutrients, showing how policymakers can actually support small-scale fisheries and agriculture and prove that blue food production should and can be sustainable and affordable. Last but not least, there's also the Growing Better report by the Food and Land Use Coalition that highlighted the 10 critical transitions to transform food and land use and concluded that the hidden costs of global food and land use systems sums to $12 trillion and many more equally important reports and evidence that just came out. And if I mention all of them, I will take all the time left of this webinar and I won't do them justice. They all, however, have the same conclusion. Transition to healthy, sustainable, equitable, and resilient food systems is possible and urgently needed for the health of the people and planet. I do believe that we have enough evidence in our hands to roll up our sleeves and implement actions on the ground. I'll stop there and happy to answer any follow-up questions.
Great. Thanks, Lujane, for bringing in that large, big question perspective, which is very valuable here. Thank you. And there are lots we can come back to, linking up the three panelists and four, counting Charlotte so far. But first, Stan, let's come to you. What do you see as the challenges around implementation? You've had a lot of experience. How do you think we can get the information needed in order to effectively implement planned interventions?
Thank you, David. And thank you for 3IE inviting me to participate on what so far has been really an interesting panel. I wish we were all together physically so we could see each other, look each other in the eye and have this great interaction. But this will certainly do. So I think what I'd like to talk about, David, in the next few minutes is simply what the evidence gap map can do and what it cannot do. And the two issues I'd like to talk about are politics and the challenges of implementation. There was a very recent Lancet series, this is in May 2022, on politics and health. And in that Lancet series, Jeremy Schiffman, who's from Hopkins, reviewed empirical articles on global health policy. And this review revealed a central role for three processes in shaping global health priorities and policies. And these three were as follows. One is the issue that is being discussed had to be important. That is, it either had to be a threat to individuals or potentially a threat to humanity, but the policy had to be important. The second important component of policy development had to be that it's ethically sound. And by that, he meant that the policies should pertain to all members of society, not only the affluent. And the third one is that the policy has to be technologically justifiable and sound. And by this, he said that using science and technology, that the question being asked had to be detectable and solvable. And in this case, science and technology would include evidence, and of course, that's where the evidence gap map plays a role, and economics. So the three important things he said for policy development are: one, had to be shown to be important; two, ethically sound; and three, technologically justifiable. Now, political scientists and sociologists who study policy making and collective action observe that the international system and national societies face hundreds of issues from poverty to crime to climate change, yet at any given moment, only a handful command substantial public attention and financial resources. Social scientists debate the extent to which the selection of issues for priority is primarily a function of evidence or a function of social and political priorities. And they say that there is a tension between evidence and political priority making. So I would suggest that evidence is actually very important and necessary, but not necessarily sufficient. Second quick comment I'd like to make is on the issue of implementation. There is certainly an important distinction between the design of health policy and its implementation. State capacity for implementation is a crucial factor that is quite different from developing evidence. If bureaucratic capacity is both strong and relatively autonomous from political interference, the likelihood of implementing desired policy outcomes is very high. In contrast, there are many governments in this situation. If government bureaucratic capacity is low, governments are much more challenged to effectively implement health programs despite political pressure and even political commitment to expand health services delivery. The relationship between a central or regional government bureaucracy and local program implementers often depends on both incentives and inducements that the government can employ to ensure that their agents, and their agents are doctors, nurses, community health workers, are important for health policy implementation. Effective governments have the capacity and the authority to ensure that their agents implement policies faithfully and effectively. Structural features of the government and implementers' relationship also matter. For example, effective implementation of specific health coverage depends on the state's infrastructure power, as governments have the power to deploy an expansive infrastructure to develop health services to everyone, everywhere, or not. So again, I'm going to go back, David, to my comment that evidence is necessary, but not necessarily sufficient. And let me end by one very quick example. We know the relationship between vitamin D and rickets. Vitamin E causes rickets. And this has been known virtually since the 17th century, when the first relationship between exposure to vitamin D and sunshine and rickets was identified. There have been policies on the books, certainly in Canada and the United States and many Western countries, for the relationship between providing vitamin D and the prevention of rickets. And in fact, in Canada, all fluid dairy products have to be fortified with vitamin D. Despite the good evidence, despite the policies, in Canada, every year, there are well over 100 confirmed cases of vitamin D deficiency rickets, with a risk in the population of 2.9 per 100,000. So despite the fact that we've known that rickets is caused by vitamin D deficiency since the 17th century, or not caused by, and despite the fact that there have been recommendations and policies by the Institute of Medicine, the Nutrition Board, and the equivalent in Canada, we still have challenges with implementation, despite the fact that the evidence is superb and well known to everyone. So let me end there, David.
Great, thanks, Dan. And in the next question, I'm going to ask you, I'll give you a chance to think about it, is okay, how do we solve that problem? So but let's go around again and give a chance to the panelists to react to what they've heard, or build on what they've heard, and add to this conversation. So, Kristen, if we can come to you next, you laid out some very important considerations about how you and your group and the foundation are thinking about all of this and what the challenges are. You're in the foundation is in an important position of being able to make a significant contribution, and are doing so. How do you take everything you've heard and wrestle with the question, it's tough to change behavior. It's tough to get from we know what to do to we actually get it done. Any thoughts on that?
Yeah, that's exactly that. Translation and uptake is the holy grail, right? You know, in getting adoption by the people you want to adopt different behaviors, getting uptake at the policy level, getting resonance and visibility at the policy level. We have an extra tough job with nutritious food systems. It's right in between ag and trade and health, you know, so aligning and thinking about policy coherence across sectors is another challenge that we think about and try to manage. Purnima brought in, you know, the great point of the important role for knowledge brokers. And it's exactly that piece, you know, that I was talking about as well, as that translation from evidence to policymakers, and how do you make it relevant and understandable and digestible? And how do you help people take this, you know, a synthesis product from one place or a piece of evidence from one place and know how do you contextualize it? What do you take away? What are the important parts that you can learn from? And then what are the additional places to go? And that's such a critical role. And it is something that we think about in how we work with governments, knowing that, you know, we consider the money at the Gates Foundation relatively small, right, compared to what governments have, what banks have, what others have. So getting that evidence in front of policymakers, helping put some technical assistance, you know, within the ministries or otherwise to pull that information up is really a critical component of the use of that data. And yes, Dan just, you know, brought up at the end there that challenge on reach too. And, you know, you can have programs, they might go a certain amount, but there's always that population that is tough. And it requires a lot of thought and a lot of effort and alignment to get to that. I'm keeping that in the back of my mind, certainly as we think about how we fund and what we fund and how we partner, who the people are in the ground are, who have that access to those hard to reach places, and how we understand what drives demand. We've all seen in the pandemic, you know, how thorny issues are, when people accept evidence, when they don't. So it's a tricky area and something that it's burning a hole in my brain at the moment.
Thanks, Kristen. Lou Jane, since you have to leave soon, let's give you a chance to come in at this point with any reflections you have on what you heard or anything you'd like to add to what you or others said.
Yeah, thanks, David. I mentioned earlier that we have enough evidence to act, but I also would like to react quickly to what Stan has mentioned. It is true that evidence is not the only thing that we need for action, but there are so many levers for action, including finance, data management, technology, governance, and many others. However, from my experience and his experience from the UN Food Systems Summit, unfortunately, many governments and policymakers uses the word lack of evidence as an excuse to halt and delay actions by saying we don't have enough evidence to act, there's a conflicting one, and we need actually consensus. In fact, we cannot just hold actions waiting for all the knowledge gaps to be covered and to have consensus. Otherwise, we won't be able to achieve the Sustainable Development Goals nor the Paris agreements. And also alluding to what Kristen and Purnima has mentioned earlier, in addition to translation of the science into something that is concrete, specific, relevant to national context and challenges, we also need to introduce some sort of a system-led policy framing for food systems actions to allow the development of evidence-based policy with a system approach, and to ensure that the research or the evidence that is out there is kind of more accessible and well communicated to decisions and policymakers. But in order to do that and to have that transition, there are several motivating and enabling factors. There will be no actions if there is no political leaderships, if there is no commitment and political courage. Once a sustainable food system is high up in everyone's political agenda, actions would follow. Second, we shouldn't underestimate the power of the people, public movement and pressure. People can demand action and add public pressure to their governments to act, particularly in relation to matters that impact their livelihoods, well-being, and the future of their children. There's also responsibility on the scientists and researchers in order to be able to ensure that this evidence is translated to action and you'll be able to translate it to concrete recommendations. We need to understand better the complex political space where the policies emerge from. You cannot influence policies and regulations without understanding the political systems and form relations within that network. And also, this is something that Purnima has mentioned earlier, which that we need to keep a close eye on our evidence-based recommendations to ensure that they can actually work, monitor the impact, learn from it, and adjust. I'll just stop there.
Thank you, Jane. And we know you'll have to leave in a few minutes. So thank you for joining. You've given us a lot of food for thought. And so let's come to Purnima now to pick up the threads from here. Just before you start, I notice in the Q&A from listeners, there's a question that I will toss out to any panelists who want to pick it up, and that is basically the focus here is focusing on saving Africans from malnutrition. It's, you know, there's the special and difficult challenges in Africa is the focus of that question. And here's another: does 3IE or other partners plan to conduct experimental impact evaluations of fiscal policies' effects on nutrition in developing countries? Fiscal meaning uses of taxes or spending, and revenue raising in general. I'll leave those two questions for panelists to think about. And Purnima, over to you.
Yeah, thank you. Wow. I mean, there's just been so much incredible discussion here. And, you know, I keep going back for me to the issue of, you know, precision and specificity around the actions that we want to see in the food system or in the building of evidence on the food system, and being able to connect the dots between, for a certain set of actions, you know, do we have adequate evidence in context to guide or to support a decision maker around that, right? I think we fool ourselves as researchers and purveyors and producers of evidence if we think that this is the only thing that matters to people. And Stan, I really liked what you said about, you know, the politics of politics and health. And I've had the great privilege of working with people like David Pelletier and Ed Frangillo and Stuart Gillespie and Jeremy on, you know, these aspects in nutrition as well. The best thing we can do is to train and help scientists who produce evidence understand where evidence fits in, you know, what is a very complex world of policy making. I think we've all had a crash course on this, quite frankly, in the last 2 years, you know, and seeing how governments responded or did not respond, or global organizations responded or didn't respond to available evidence on the pandemic. What we've seen in the world of nutrition or in other sort of areas of global public health has been a much more slow-moving recognition of how complex the world of politics, the world of sort of decision-making around specific areas that affect the public good, which is what we are talking about here with the food system. We want people in sort of very critical decision-making spaces, be they, you know, spaces that allocate financing, be they spaces that design nutrition strategies, be they spaces or people or actors who you know, make decisions about specific areas of programming. We want all of those people to act on evidence that is relevant to their actions. And I think we are still talking in great generalities when we say we want you know, evidence to move to action. I think the more specific we get about the action that we are speaking about or concerned about in a certain context, the more we will be able, I think, to help and to support people who are making those decisions with evidence in the time span, is sort of in the time scale and in the context that we need. And I think the only way really for us to do that is to embrace the idea that researchers need to be really tuned to what happens in policy and decision-making spaces without it distracting them from too much from the doing of the high-quality research. But we need to be sensitive, we need to be sensitized and to understand that very well. And there's no other way, I think, than to really embed that into research training very, very early in the lives of researchers. You know, I had the privilege of getting oriented to that both during my PhD and my early postdoctoral years. I think it was profoundly impactful. It allowed me to see the world of evidence to policy in very different ways and reduced a lot of my frustration, quite frankly. So I think even to policymakers, you know, we need to understand their world and appreciate how complex it is for them and be able to deliver what they need when they need it. We can't be operating in different timescales or in different contextual spaces. And so what I'd really like to see is much more of this discussion, but I'd also love to see groups like 3IE and STAN, you know, of course, people like yourselves in global universities, universities around the world, really creating opportunities for researchers to learn more about this world. Policymakers are our allies. They are incredibly smart people. Most of them want to do the right things. We're just not always able to meet them with what they need, precisely when they need it, and precisely for the decision that they need to make when they need to make it. So the more we can, you know, create community and connections between these two worlds, which are not opposing at all in terms of the public good, but just operating with very different incentives and very different decision-making timescales, I think the better and better we'll get at helping evidence inform actions alongside the other things that inform actions, you know, financial sort of issues, values, political imperatives, et cetera, et cetera. So let me leave it at that and really, you know, hope that we can continue on both in this dialogue, but also really in the training of ourselves, really also that I think we need to be doing as we look forward to in this world of, you know, how do we get more evidence to action. Thank you again for, you know, really such a great conversation and the opportunity to be with you today.
Great, thanks, Purnima. Now we'll go to Stan and then Charlotte, and then we'll check in as to where we are. I would like to sort of bring again from all of the great comments that have been made, this question of how do we get from what we are reasonably sure should be done to actually getting it done, and pose the question, are we within nutrition doing enough thinking and work, not on the science of nutrition, but on the science or art of persuading people to change behavior? And what comes to mind is there was a time when nobody used seatbelts, and smoking was considered the cool thing to do. And at those times, if you had had a panel like this and said, what are the chances we will change those behaviors? It would have been overwhelming, impossible, can't be done. People love to smoke. They're never going to belt themselves into cars. On the other hand, I remember years ago when, and I'm sure many people here also know, we identified the sort of basic micronutrient issues, you know, vitamin A, iron, and iodine. And we said, gee, these are easy, they're cheap. To solve these, we'll be done with this in 10 years. And yet here we are many, many years after that, and we haven't solved those problems. So I leave all that as sort of stimulus, and Stan, whom I know well, is going to have perfect answers resolving all of our uncertainties.
Oh, thanks, David. I wish that were the case. I'd first like to say that, Purnima, you have expressed yourself so clearly and so well around the issue of science and politics. I was going to say much of what you said, but you've said it much better. But I would like to make the point, David, that I think this discussion about evidence has to have a pre-pandemic and a post-pandemic viewpoint, because, Purnima, you used the word public good as if everyone would agree of what is public good and what isn't public good. And it is incredible to say that maybe half the population wouldn't agree with what you and I would think is public good, whereas 3 years ago, we would never have had that conversation. 3 years ago, I would have said, as a scientist, evidence is the absolute most important thing, and have evidence that everyone is going to agree. That is definitely not the case today. And it is sad to say that, but it is the fact. David, I have no solution to the problem, but one of the things I would like to say is that we as a group, I think, have to support the UN and its agencies. The World Health Organization, I think, has done a superb job over the last 5 or 6 years in collecting evidence, doing systematic reviews, doing meta-analysis, and coming up with recommendations. And these are recommendations that are based on science and evidence. And for policymakers in low and middle income countries, including Africa, I think the recommendations by the WHO become and are extremely important. And in fact, much of the policy based in low and middle income countries is based on the technical expertise that is the WHO. So David, I think going forward and currently, one of the ways that we're going to maximize the value of evidence is by supporting the UN systems, by supporting WHO to continue in what they're doing to provide evidence to policies, particularly in low and middle income countries.
Great, thanks, thanks, Stan. A very important reminder. We have institutions, let's use them. Charlotte, your thoughts at this point?
Yeah, I think this has been a fascinating conversation so far, and it gives me a lot to reflect on in my own work in terms of how I can take the strong science and rigorous analytical approach that 3IE is so good at bringing to the table, and think about how to take that and move it into this real world actionable context that we're having this discussion around. Stan, you mentioned the WHO and the great recommendations and approaches that they have to coming to guidelines around health policy, health systems. It would be great if we could move that into this field as well, right? So that does a really good job for things like breastfeeding, malaria treatment, and whatnot. But how do we think about similar approaches in the agricultural sector, in sort of this nutrition sensitive space, as well as the more targeted WHO purview? There are approaches like GRADE and other maybe more synthesis of types of approaches that can help us get to these strong recommendations that policymakers are asking for. But we have to think about how we do that, how we communicate it, and have all of that additional nuance that tends to get lost a lot of the time. Like Kristen was saying, between, you know, the image at the top of a page into all of the nuance about what we're actually trying to say. And I think that there is a challenge in terms of potentially losing policymakers along the way there. So this is an important thing that I think we all have to bear in mind. We did get one question on fiscal policies and working to evaluate those in particular, since that's something I talked about at the top of this. I would love to evaluate some fiscal policies in LMICs. That sounds super fun and interesting. Like I said, there is one IE that has done that so far in the entire world, thinking about health and well-being outcomes. So I would love to do that, and there should be more.
Great, thanks, thanks, Charlotte. And we've extended beyond the time, so I think we do need to be respectful of people's time and begin to wrap up. I'm going to just respond to a few of the questions that have come in the chat, and then check around with the panelists if you've got a last word or two you'd like to say. Charlotte already mentioned that doing some evaluative work on the impact of fiscal policies is something that needs to be done. It is done, more should be done. And there is quite a bit of evidence to build on, and we should probably draw on that. There's another question about making sure that the serious problems in Africa are addressed. This seems even more important now in the wake of the war in Ukraine, as delivery of products will be disrupted, has been already, and what will be the ripple effects throughout the world. So there are major unsolved questions and great needs there, thanks to the questioner for asking them. There was also a question about mobilizing communities to transform food system, more of a comment. And how do we engage with communities? How do we ensure that some of the energy and ideas coming from the grassroots up are harnessed and supported and enabled, since people who are close to the problem are the best place to help solve it. So these were some of the points that came up, and thank you for all of those. Let me check now around to see, starting maybe Kristen, any last comments or questions you'd like to raise?
Yeah, I'll just note, I appreciate the dialogue and discussion. It's been interesting for me as well. And it's just incredibly hard work. And, to the question about community organizations, also the UN, what their role is, getting those voices up, getting community organizations, getting that knowledge, that intimate knowledge, and to Stan's point about reach, they have that intimate knowledge of who the people are, how they think, how they behave. They're also a critical part of a translation piece. When we have evidence from one place, how do we match it to another place? Community organizations are critical in that. Getting LMIC countries, governments at the table to discuss some of the implications for policies and programs, how Kodak standards apply to their context. That linkage, that forward, backward linkage, cross horizontal linkages are critical, I think, to have some of this effective work. And I'll stop there.
Thanks very much, Kristen. Purnima.
Really nothing much more to add, except that I think, where things like the evidence gap maps and evidence syntheses lead us towards is creating more consensus within the knowledge community, which I think is profoundly important in taking the idea of evidence to action. Over and over again, I think we see that where the evidence itself is contested or where there is no consensus around the evidence, it becomes very easy for people who should act on different parts of the evidence to leave that particular issue aside. But the more work that we can do to continue to keep our eyes on bringing evidence together, creating consensus on at least what we can agree on or where the gaps are, I think the more we can help sort of reduce the risk that people won't act on the evidence. It's a much better approach and a way for us to move evidence towards action than individual researchers trying to upsell their individual pieces of research to individuals in policymaking communities. So to me, the idea of consolidating evidence, synthesizing evidence, communicating and engaging people around key insights from synthesized evidence is really a set of critical steps on a pathway towards more integrated use of evidence in sort of different actions in different contexts. So I do want to encourage us as a community to keep investing in this area of work, because it dampens the infighting or sort of internal disagreements when we do more synthesis work and we do it together. I think it is to the benefit of the research community as well as the evidence to action community to keep investing in the kind of work that you're doing here, and to do so with the range of different actors that exist who are also doing evidence synthesis and translation to guidelines. So I want to thank Stan especially for bringing up the important role of the WHO and UN agencies here. So yeah, that's all from me. Thank you again.
Great, thank you, Purnima. And Stan.
Thanks, David. And once again, thank you to 3IE. This has been really an interesting discussion. I'd like it to continue for the next 3 hours. I really have not much more to say other than the fact that given the time we're living in, I think the quality of the evidence and the value of the evidence that we're producing as scientists and that you, 3IE, are putting together is even more important today than it was pre-pandemic. So continue your work, continue it with rigor. And as scientists, we must insist that evidence is the way forward as opposed to what other methods people are using to make decisions. So great work, David, and your group. Please continue.
Thank you, Stan. And Charlotte.
Sorry, I lost my cursor for a second. As everyone's been saying, this has been a really interesting conversation for me. I think that we're in obviously really hard times at the moment when it comes to food systems and nutrition. That is always the beginning of every single one of these conversations. And we do have an urgent need to make serious change and do it now. And in order to do that, this highlights that we need not only evidence, but we need action and movement based on that evidence. And I am optimistic that this is a place that 3IE can keep working, but also that we can work with all of the panelists as well as the various people who have been listening to this call in order to achieve that goal.
Great, thank you. And let's hope that we can keep this conversation going through many different fora. I'll just leave with one comment that a very successful Minister of Finance from Africa once made, who said, as a policymaker, I'd love to have evidence and research answer all my questions. But even if I can't get that, I'd like it to improve the questions I ask as I try and figure out what to do. And that struck me as a pretty important goal. We can perhaps, policymakers have to ask questions, and let's help them ask better questions. Great. Well, thanks, everyone. And again, for your time. All the best. Bye.